Have you ever wondered how we understand the unknown through the known? This is a process we engage in so often, yet we seldom think about it. It's called Upamana, a concept from Indian philosophy that deals with knowledge acquired through comparison. Upamana, derived from the Sanskrit language, is a term that signifies gaining understanding or knowledge, called upamiti, through comparison or analogy. It's like a bridge between the known and the unknown, helping us navigate the unfamiliar by using the familiar as a guide. Picture this: you're in an unfamiliar place and you come across an animal that looks a lot like a cow. You've never seen this kind of animal before, but because of its resemblance to a cow, an animal you're familiar with, you identify it as a gavaya. This process of comparison and conclusion is upamana. Upamana is not limited to physical resemblances. It also applies to abstract concepts. For instance, if a patient's body becomes stiff like a stick, a doctor might diagnose the condition as dandaka. Here, the doctor has used the known concept of a stick's stiffness to understand the unknown, the patient's condition. In the realm of Indian philosophy, the concept of upamana is not universally accepted. While schools like Sushruta Samhita and Nyaya Darshana accept upamana as a separate source of knowledge, others like Sankhya, Yoga, and Vaisheshika do not. According to the Nyaya school, upamana is an independent source of knowledge because it doesn't fit into the categories of pratyaksha, which is perceptual knowledge, or anumana, which is inferential knowledge. In upamana, complete knowledge is not gained through perception, and the knowledge gained is not based on any previous perceptual knowledge. This method of comparison is also used in identifying diseases, drugs, and even understanding human anatomy. For instance, in Ayurveda, Bhumyamalaki is compared with Amalaki, and Daruharidra is compared with Haridra. Similarly, the heart is compared to a lotus, and semen is compared to crystal or oil. In understanding the nourishment of bodily tissues, or Dhatupashana, Upamana is used in the form of 3 Nyayas or maxims: Kashira Dadi Nyaya, Kedari Kulya Nyaya, and Kale Kapoda Nyaya. Upamana also finds its use in understanding treatments.
Correct diagnosis critical in medical science. It's the first step towards effective treatment. It's like finding the right key to unlock a door. But how does a physician ensure that their diagnosis is accurate? They use a variety of tools and techniques. Knowledge through comparison. It's a method of understanding something unfamiliar by comparing it to something familiar. This concept is widely used in Ayurveda, the traditional Indian system of medicine to diagnose diseases. It's akin to a detective using clues to solve a mystery. Consider the disease Jalodara, also known as ascites. When a physician examines a patient with this condition, their abdomen feels like a leather bag filled with water. This familiar sensation helps the doctor diagnose the unfamiliar disease. The stiffness of the water-filled bag and the abdomen of the patient suffering from ascites are similar, making the unknown disease easier to comprehend. Another example is Charmakushta, a type of skin disease. Its symptoms include thick skin that feels rough to touch, similar to the skin of an elephant. This comparison helps the physician identify the condition. In the case of Ekakushta, another skin disease, the patient's skin appears like the scales of a fish. This likeness aids in understanding the clinical features of the disease, correlating it with modern psoriasis due to the formation of silver-colored scales. Kakanaka kusta, a severe skin disease, shows a similarity with the seeds of Abrus precatorius Linn in color and size. This resemblance aids in the diagnosis. Kamla Vyadi or jaundice presents with a color change in the eyes, skin, nails, and mouth, similar to Kurkuma longa. This comparison facilitates the diagnosis. In Nilmeha, the patient's urine turns blue, similar to a blue-colored bird. This symptom helps even a layman to identify the disease. Mukadushika, a condition causing eruptions that appear similar to the thorns of Salmonella malabarica, especially on the face, is easily identifiable due to its distinct appearance. In summary, Upamana Pramana is a vital tool in the diagnosis of diseases, bridging the gap between the unfamiliar and the familiar. Its wide utility ranges from helping physicians make accurate diagnoses to aiding laymen in recognizing diseases. It's like a compass guiding us through the complex world of medical science, making the unknown known through the power of comparison.